Today's topic is really important. I want to talk about insulin resistance. How long does it take to become insulin resistant? And can you reverse insulin resistance? And after you watch the video, make sure you head on to my website and take my quiz. It's 10 easy questions and I give you a personal health report and a lot of great information. If this is the first time you're meeting, my name is Michelle. I'm a nurse, health coach, and a personal trainer, and I help type 2 diabetic patients reverse their type 2 diabetes naturally, get off medication safely, and the best part, be free from all the complications related to type 2 diabetes. Let's get started. As I mentioned, this topic is really important. A lot of times when I meet with a client, they tell me that they've just been diagnosed with prediabetes or they've just been diagnosed with type 2 diabetes. But I want to make sure that you guys understand that this just didn't happen. The process took many, many years. The underlying problem of type 2 diabetes is insulin resistant and hyperinsulinemia. So we go from insulin resistant to prediabetes to type 2 diabetes. The insulin resistant part, it takes many, many years. It takes 10 to 20 years for someone to go from the insulin resistant stage to being prediabetes. Let's look at a body as a machine that can tolerate carbohydrates. Now, there is a certain threshold of how much and for how long it can tolerate it. And if we push it too much for too long, then we're basically going to break this. And to be able to fix it, we have to take some drastic measures. For someone who has a normal insulin sensitivity in the body, they eat the food, the blood sugar goes up, and the signal is sent to the pancreas to produce just enough insulin to get the glucose out of the blood and into the cell. So basically, all we need is a little bit of insulin for a little bit of glucose to make sure that the blood sugar is in normal range. And the whole point is to maintain a steady fuel delivery to the cells of the body. So insulin has a very, very important role here. It gets the glucose out of the blood and into the cell. And our body is very sensitive to this signal because we just need a little bit of insulin, right? And then the blood sugar is in a balanced level. Now, over the years, the more carbohydrates we eat, the more sugar we eat, the more stressed we are throughout the day, the less we move, the less we sleep. The more frequently we eat throughout the day, we are going to have more blood sugar spikes. And it's going to get harder and harder for the insulin to get the blood sugar into the cells. And eventually, there's going to be more sugar, it's going to be more insulin, and the cells of the body are going to start resisting it. And the insulin level in the body starts to go up. As I mentioned, the process doesn't happen overnight. It takes 10 to 20 years. Now, during this time, your blood sugar is just going to look fine because your body is doing such a great job producing more insulin and making sure that blood sugar is under control. But you might be having some signs and symptoms that you can pay attention to. For example, midsection obesity. You might have that stubborn belly fat that just doesn't go away. You might be having a really hard time losing weight, being thirsty or having to urinate a lot throughout the day, experiencing energy fluctuation throughout the day, having high blood pressure or high triglycerides, having skin issues like skin tags, feeling tired after eating. These are all signs and symptoms of insulin resistance. But eventually you are going to see your doctor and take your blood test and your A1C, and now you're going to be seeing your blood sugar in a prediabetes range, which is between 100 to 125 fasted blood sugar, and an A1C 5.7 to 6.4% range. Because at this time, no matter how much your pancreas produces insulin, is just not going to be enough to get the blood sugar under control because the body has become so insulin resistant that no matter how much your body produces insulin is not going to be effective. Now you have severe insulin resistant plus prediabetes, or you have been diagnosed with type 2 diabetes. So as you can see, the process didn't happen overnight. And a lot of times patients ask me, how long does it take for me to be able to reverse my insulin resistance and eat normal again? And my question is always, what is normal to you? Because the standard American diet is not a normal diet. It's full of sugar, it's full of processed junks, and it's just not real food. Also, why would you ever want to go back to eating what got you sick in the first place? So this point is really, really important. The good news is that by following a low-carb diet, intermittent fasting, by managing your stress, by walking and start resistance training, you can reverse your type 2 diabetes, you can reverse prediabetes, and it is possible to reverse insulin resistance, but it might take many, many years. Because as I mentioned, the process didn't happen overnight. It took many years, and to heal the body, you do have to make some drastic changes in your life. It is going to take years to reverse insulin resistance. The first thing you're going to see when you change your diet, when you start on a low carb, you are going to see your blood sugar in a normal range. Now, this does depend on what stage you're at. If you're in a pre-diabetes or type 2 diabetes, if you're taking a lot of medication, if you're on insulin. So please be patient. This is different for everyone. The good news is that you are able to do something about this, and you should, because unlike any other disease, type 2 diabetes affects every single organ in the body. It affects your brain, Alzheimer's, stroke, it affects your heart, you can get a heart attack. It affects your nerves in the body, you can have neuropathy. It affects your kidneys, affects your liver, affects your eyes, you can go blind. Amputation, having ulcers, having a recurrent infection. These are serious complications of type 2 diabetes. We don't talk about you're stronger than you think, you have the power, you can do something about this. But medication is not the answer. All medication does is mask the problem. Your diet, lifestyle changes are the key in helping you reverse your type 2 diabetes and insulin resistance. I hope the information I shared today was helpful and useful to you. Reach out to me, let me know if you have any questions. Share your story with me. I'm always here to answer questions and help. See you next week.